The country, and really the entire world, is now living with two simultaneous pandemics. Today, the White House declared the monkeypox outbreak a public health emergency in the United States. The move comes almost 2 weeks after the World Health Organization declared monkeypox a global health emergency. And in practical terms, the declaration of a public health emergency frees up government resources to make vaccines, testing, and treatment more available. Health officials in New York, California, and over in Illinois declared states of emergency earlier this week, and many health experts are wondering, what took the White House so long for their declaration? Administration officials acknowledge they are now playing a little bit of catch up as case numbers grow faster than they initially expected. According to an NBC News analysis of CDC data, the 7-day average of reported new cases increased from 45 on July the 11th to 214 just 2 weeks later. And joining us now to discuss, Dr. Saira Madad, an infectious disease epidemiologist and senior director of the Special Pathogens Program at the New York City Health and Hospitals System. So, Dr. Madad, tell us what we need to know about monkeypox. I think there's a lot of confusion about how it spreads, who can be infected with monkeypox. So break it down for us.
Yeah, that's an excellent question. Certainly, with today's news, I'm sure all Americans are trying to figure out, well, what is the threat to me? And so I think first it's important to understand that monkeypox is circulating in many communities in the United States. We're seeing, as you just projected, doubling of cases in a little over a week's time. Just imagine, in 3 days, we've seen over 1,000 cases. So this virus is certainly circulating in our communities. And what we're seeing in terms of the epidemiological data is that majority of these cases, are being reported in individuals that, are male. And when we look at additional risk factors, they are men who have sex with men and have multiple sexual partners. And right now, transmission is largely being driven by skin-to-skin contact or intimate contact. So through anal and oral sex, through kissing, hugging, massaging with individuals that are infected. But there are other modes of transmission of monkeypox, and this can include, non-direct contact with these lesions. So through contaminated objects, through droplet, respiratory secretions and close, prolonged contact. So these are less defined ways of how this virus is transmitting, but majority is being driven by, skin-to-skin contact through sexual activities.
So in terms of transmission, that also includes fomites, right? Touching things. So help us understand what are the steps of mitigation we need in the last few minutes here to protect ourselves from monkeypox. Are they the same as COVID?
Yeah, so that's a really great question. So first, monkeypox and COVID are two very different viruses and require two very different responses, if you will. So basic foundation is the same when it comes to outbreak response. But when we talk about fomite transmission, especially with monkeypox, certainly there is a theoretical risk, but a lot needs to happen. So an infectious individual has to obviously be touching, a surface, contaminating it. Another person that's not infected picks up that virus. But even if you pick up the virus, you need to have enough viral dose to cause infection. And then you also have to have an opening where this virus can get into, and it has to be a replicating and live virus. So certainly it's a possibility, but that is not what's driving this epidemic that we're seeing certainly here in the United States and in many countries that are reporting this cases.